Hello, thanks for joining me. My name is Michelle Moser. I'm a clinical liaison with Revelation Pharma, and today we're going to talk about adrenal health. So let's get started. Just want to let you know that this webinar is for informational purposes only. Medical advice should be sought after in discretion of your medical provider. And I'm going to talk about compounded medications, which are not necessarily FDA approved. We're going to talk a little bit about the hypothalamic pituitary axis and how that affects thyroid, how to look at different tests that may be helpful in managing stress, and how do sex steroid hormones play a role with stress, and also those compounded medications that may be helpful in alleviating very stressful situations. One of my favorite books that I read once upon a time was titled Fat, Fuzzy, or Frazzled. And a lot of times I say, what do you mean, or? Can it be and? Because a lot of times when I talk to patients and even providers, this is an and situation, that people are feeling larger than they wish. They don't feel as healthy. They don't feel as present. And they're very quick to feel the stress because stress is so chronic that it just tends to build up with time. What we do know is that stress and its related issues is the #1 killer in the United States. It can interfere with hormone imbalances, be the source of low libido, can be also source of weight gain, especially when weight is gained around the middle section. It can definitely impair blood glucose levels. It can cause increase in those levels, which can then lead to cravings, mood, and even bad breath. When we have a lot of stress, especially chronically, we also see an increase in a wide variety of inflammatory processes. And those processes are not necessarily due to like a raised area on the skin or something like that. It actually happens more internally, associated with blood vessel volume and constricture, but can also lead to aches and pains and even migraine headaches. We see that stress is definitely behind a wide variety of anxiety and depressive states, as well as that dreaded insomnia where you're either having a hard time turning it off at night so that you can get to sleep or even just staying asleep. And a lot of times when people are having night sweats or hot flashes at night, it may not necessarily due to an estrogen imbalance as much as it's a cortisol imbalance or even a cortisol metabolite. We know that oxytocin goes down. We know that there can be changes with hair, skin, and nails. Dehydration is a thing. And with that comes nutrient depletion. So here's a little bit of a diagram on how the HPA axis works when it comes down from the hypothalamus, works through the body through different chemical reactions, works on the adrenal cortex, which then excretes cortisol. And there is a fight or flight syndrome that happens with that. But what we also know is that this doesn't have to be an urgent response or an emergent response to like slamming your brakes on because you're going to hit something in front of you or a lion running at you. It could very easily be a worry. It could be a loss. It could be a metabolic disorder happening in the body as well. The body works on all of these stressors the exact same way. It doesn't differentiate between them. The next 3 slides are a list of general symptoms. And what I find very interesting is that these symptoms come up every single day. They are just exactly that. They are a list of general symptoms. But because of that, when we add them up, we can actually see just how stressed a body is. So if we gave a point for every symptom on this list, and even a light tremor could very easily be due to a type of inflammatory response due to high cortisol levels. But even this list, so if we gave a point to every single one of those, that person is incredibly stressed. And what's even more troublesome is that we don't put enough emphasis on reducing stress in our lives. Typical Americans just accept it that this is just how their life is, and they're not really sure what to do about it. A wide variety of providers aren't really sure how to measure, and then what tools are available to help change those responses and lower the stress. They can be very simple things done in the privacy of someone's home or while they're sitting in their chair at work. But sometimes it's a matter of really doing a deep dive and being very honest with ourselves as to, exactly what does our diet look like and what kind of exercises are we doing? We don't have to train for a marathon. Sometimes that makes it worse. But what we do see, especially on this list, we see a lot of people complaining about cravings, about being really tired about 2-3 o'clock in the afternoon, and they're just hitting a wall. So what do? They go toward caffeine. They grab a Snickers bar or some kind of a sugary or a salty food that can help alleviate some of those symptoms. And some of those people are really irritable in the afternoon because they're hangry, or their body thinks that they are hangry. Whether it's a salt craving or a sugar craving, all of these are very typical responses to a stress issue. Now, when we take a look at thyroid, when I was investigating and doing some research about this topic, I thought, adrenal, well, a lot of providers just don't do much about it. We just kind of gloss over the top because what are we supposed to do? But what I find is that the HP axis has a very direct correlation to thyroid health, because the HPA axis has a dramatic impact on the HPT axis, so the hypothalamic thyroid axis. And literally the only form of active thyroid, which is T3 liothyronine or triiodothyronine, can be impaired. It can literally be blocked when cortisol is elevated. But also what I found is in the package insert of levothyroxine, so a very traditionally prescribed medication, prescribed every day, day in and day out. There's a warning in that package insert that literally says that providing thyroid replacement therapy is contraindicated if there are adrenal issues. So in other words, that package insert is saying, deal with the adrenal issues first and then take care of the thyroid. But I just don't see that in practice. I've been a pharmacist for 36 years, and I just don't see a lot of help being provided, especially to those who are very stressed out. Because after all, stress is just part of our everyday, right? Well, it is, and we're never going to be able to get around it. But there are ways to help minimize the impact to our bodies. So a lot of times, sex steroid hormones like estrogen, progesterone, pregnenolone, as well as testosterone can be impaired. And there are some citations that high cortisol levels can interfere with the normal production of both testosterone and oxytocin, hampering in men and women with their attempt to reduce stress. But we also know that cortisol will actually bind to the same progesterone receptor site, which will not allow progesterone to then bind to that receptor site. Then what happens is that even if somebody has low levels of estrogen or moderate levels of estrogen, they have symptoms of excessive estrogen, because on those cells that have estrogen receptor, there's a progesterone receptor right beside it. And we need those two sisters to couple together so that they can act more efficiently and more productively. So if you only have one, you're not going to have the same response. It's very interesting. But again, when we look at the list of complaints that men and women have when it comes to evaluating their sex steroid hormones, that list could very well be superimposed on the list that I gave a few slides back. We also know that gut has a very strong impact, and we know that the gut really is our second brain. So if our gut is not healthy due to stressor issues, then we can see that the body won't be healthy either. Increased cortisol can decrease the permeability of the gut. It can increase the junction size between the cells, allowing for increased inflammation and even more normal metabolite byproducts to escape through those junctions and end up in the periphery, even on the skin. Stress can change the gut biome over time. It can decrease the production of those metabolic end products that are very important to stabilize mood, to stabilize inflammation, to stabilize homeostasis. When we have an increase of acid production in the stomach, we see a decrease in enzyme activity for metabolic production as well. So stress can affect every part of the digestive system. Even when we look at heart disease and diabetes. So earlier I mentioned that when we have high stress, we can even have changes in our oral health, and we can have changes in our gut health as well. But we know that if the oral cavity is not as healthy as it could be, that can be a precursor to heart disease. Elevated cortisol levels allow for glucose to leave the cells. It leaves, then the pancreas increases insulin production, and we either utilize that glucose or we don't. And if we don't, then it turns to fat around the midsection. Very common. When that happens, then we usually have a decreased sensitivity of glucose in those cells, and that's what we call metabolic syndrome. We can also see that with the cravings and a wide variety of inflammatory processes, it's really a catch-22 that a lot of times blood pressure will go up, cholesterol will go up, triglycerides will go up, blood glucose levels will increase as well. Then we have more digestive issues. We have a weakened immune response. We have a higher risk of cardiovascular disease. We see more anxiety, more depression, more headaches, and we see a very sick body. But we can literally walk down the street and be able to pick out the majority of those individuals that have a higher degree of this issue due to stress, whether it's metabolic or a worry or a physical ailment. We see that truncal obesity, so a lot of weight around the middle, is definitely a contributory factor to increase morbidity and mortality rates. Increased homocysteine levels can also be due to elevated cortisol levels, which can increase the risk of heart disease and insulin resistance. The aging process, Americans spend billions on this every year. Wonderful cream or serum, a wide variety of procedures to help decrease dark spots, to increase lift in the skin, to help with droopy eyebrows, to help with droopy eyelids, change the texture of the skin to decrease wrinkling, decrease dark spots under the eyes. But whenever we see fullness in the cheekbones, we see mucin actually collecting here, that could very easily be a thyroid issue. That could also be an increase in cortisol levels due to stress. And that can be diminished again by working at the heart of the issue and learning some corrective technique on how to lower stress. Over the last, 3 years, it's been pretty stressful out there, not knowing exactly what was coming at us and when, if we were going to get sick, if we were losing loved ones, whether or not we were going to have a job, what was happening with our homes, and just being in fear. And thankfully, we're on the other side of that, but that doesn't mean that we shouldn't prepare and be healthier just in case anything like this were to ever happen again. I mean, the bottom line is, if we're able to increase the health and well-being of our bodies, we don't see that much illness. So really, food is foundational for that. Food is foundational for our skin as well. But we also need to see changes happening with the productions of our foods, as well as the foods that we're putting in our body. Grumpy, frumpy, and just generally not interested. When I've had a wide variety of ladies seminars here in the store or even online, I hear over and over again how a woman is very much in love with her partner, but she just doesn't care if she ever has sex again. And I find that very, very sad, because quite honestly, that intimacy is so important to our everyday life and well-being. You know, we need food, we need shelter, and we need companionship to have really good, healthy lives. But if we're stressed, our body literally tells us, it's not time to replicate. So the whole idea and the whole desire to be intimate decreases. So what exactly can we do to minimize our stress? We can't change the impact that is coming at us, but we can change the way we react. Some people lean on aromatherapy, and there are a wide variety of diffusers that are available. And there's a wide variety of scents that can help with the impact of stress, whether it's rose or lavender, and sometimes even eucalyptus can be very helpful. It just depends on how stressed the body is as to which aromas we're going to be using. Guided imagery can be very helpful, and there's a wide variety of apps that are available to download to your phone. Several of them produce calming music. Sometimes it is a series of waves that come into shore, and you can actually visualize that. And as the wave goes out, it takes the stress, and as it comes in, it just replenishes and nourishes the body. But through that guided imagery, those apps can gently take us down a road where we can drop off our baggage and drop off our stress and not come back and pick it up. There's also breathing exercises, and a lot of people have used these in times of stress, but also in times of pain. Now, if somebody sighs all the time, that usually means that they're pretty stressed. So what you can do is inhale for 5 to 7 seconds, hold for 1 or 2, and slowly exhale through a small opening in your mouth for about another 5 to 7 seconds. That can drop your blood pressure by several points just by doing it once. You can actually repeat that method over and over again. Just be careful that you don't hyperventilate. Journaling. Sometimes people can actually pull out their stresses and shoot it through their fingertips to their writing implement just by writing down exactly what is on their mind and what's bothering them. And that's something that can be very helpful, especially at 2, 3 o'clock in the morning when you wake up and you're like, oh my gosh, I've got all this stuff in my mind. What do I do with this? Oh my, geez, I got to get back to sleep. I've got a big day tomorrow. What's going on? So if we don't have good quality sleep, we can have issues throughout the next day, which can compound yawning and sighing and gravitating toward foods that are less healthy. So write it down, let yourself know you've written it down. It will be there in the morning for you to review. You can let go of it now. It's time to go back to sleep because we have a big day ahead of us. Start some breathing exercises. But what you can also do is progressive muscle relaxation, whereas literally you shake your limbs out. Whether you're laying down or sitting down or standing, it doesn't really matter. But you literally visualize your scalp being tense and letting it go. Your forehead being tense and letting it go. Your facial and neck muscles, let them go. Then work down your shoulders, your arms, your trunk, all the way down to your toes, and just slowly let go of their tenseness. And that muscle relaxation can also help you to move on and be a little more relaxed. And then lastly, I wanted to add meditation. Meditation can be prayer. It can be thoughtfulness. And a lot of times people need help to understand exactly how do you do something like this. So again, there's some wonderful apps as well as YouTube videos that can literally teach you how to be mindful, how to meditate, and how to pray more effectively. Of course, if we're going to really understand what is happening in our body, we can always take a look at cortisol levels. In my professional opinion, the easiest way to do that is with a salivary test, because it's a kit that you can literally take home and perform at home, either in the morning, at night, or even at two other points throughout the day. And this testing company actually has a wide variety of adrenal health panels, as well as a combined salivary panel and blood spot panel, which you literally poke a finger and then put blood droplets on a card that can then be folded over and sent away. And not only can we take a look at sex steroid hormones, but we can take a look at cortisol and the adrenal metabolites. What's really important about understanding all of this is that through here, we can literally make changes by supplementing those hormones that are deficient, but also using vitamins, minerals, herbs to help decrease the impact that the adrenal cortisol and metabolites have on the rest of the body. And we can pull all of that down. So that, coupled with meditation, journaling, being mindful, and also some relaxation techniques, as well as good hydration and good foods, mild exercise, we can make a dramatic impact. So let's talk about some of those hormones and some of those other compounded medications that can also help support cortisol issues. Of course, we know that if we have extreme high cortisol levels, we call that Cushing's disease. And if it is such that we don't make enough cortisol at all, we call that Addison's. And we can use medications, compounded or commercial, to help support those extremes. But most people fall in between those extremes. Oxytocin is that wonderful cuddle drug that helps us to connect with other people. And oxytocin helps us to feel calmer, to feel more centered, and to alleviate the impact of stress. We compound that into a nasal spray, works very, very well for a lot of people, and also really helps with the grief aspect as well. We can also use low-dose naltrexone, either in a capsule, a tablet, a sublingual troche, a sublingual drop, and a transdermal gel. And we would use that to help minimize inflammation that is caused due to elevated cortisol levels. Low-dose naltrexone can also help the beta cells of the pancreas to work more efficiently, so we can also minimize the impact of elevated blood glucose levels. There's also a wide variety of other issues that low-dose naltrexone can have an impact on to, again, help further increase health. We also use it in conjunction with depression medications to help decrease weight and cravings. Of course, replacing bioidentical hormones can be done in creams, can be done in capsules or tablets, can be done in vaginal preparations as well. And by measuring exactly what's going on with the hormone levels that replicate what's happening in the cell, understanding where those levels are, along with the symptomology that that patient is carrying, then we can design a medication at an applicable dose that is best for that person. Then we can also talk about infusions, whether it's glutathione or other immune response medications such as Meyer cocktails, a little selenium, infused vitamin C, magnesium. All of that is very helpful in reducing stress, helping to modulate the immune system, but also decreasing the overall effects of adrenal impact. We can measure micronutrients. So exactly what's happening with chromium, selenium, as well as a wide variety of the B vitamins and other minerals. And that can be done through a variety of labs in a blood sample. And then when we understand what needs to be replaced, we can design a micronutrient infusion as well, or even an oral capsule to help replace exactly what is necessary. Anytime that we look at a wide variety of supplements, one thing that we usually gravitate toward are the adaptogenic herbs. So whether we're talking about ashwagandha, holy basil, schizandra, rhodiola, magnolia, maca, and the variety of ginsengs. So if we fully understand exactly where that individual is with their cortisol levels and their cortisol level metabolites, then we can then use these supplements to help further decrease the overall symptom list associated with elevated cortisol levels. Now, sometimes cortisol levels can be high for so long that we see some hypoadrenalism, what used to be called adrenal fatigue. I mean, the organs don't really become fatigued, right? They just produce less and less of this or that. So if someone is stressed for a long, long period of time, they could actually produce less and less cortisol, and we can simply replace cortisol. We do that either with over-the-counter bovine supplements, or we can do that in a compounded medication as well. So I wanted to let you know that you can contact me through the LDN Pharmacist. You can, these are my 2 social media handles as well, or you can get a hold of me at my email or my cell phone here. I want to thank you very much for joining me today. I hope this has been informative. And if you have any other questions, please feel free to reach out. This is the list of pharmacies that I'm currently associated with. We'd be more than happy to set up a one-on-one interview or session with your provider group and also your patient panel. Thanks so very much. Have a great day.